PCV. PCV means packed cell volume, or hematocrit. Hematocrit means the volume of the entire RBC only, no? In 100 ml of blood. So at first, definition of PCV, then what is the normal value of PCV? She has already told, but I have always told you that always tell that in range. What is the normal value of PCV in male? 40 to 50. In females? 37 to 47. -3. Okay. Okay. Now we all know why PCV is very important to calculate. Why? It is the most correct method to determine anemia quantitatively. And anything more? Polycythemia also. Okay. How can you detect a chronic infection in measuring in this hematocrit? ESR is not PCV, na? ESR तो अलग होता है. What is PCV? I am not talking about ESR here. I am talking about PCV. ESR is a different experiment. PCV is a different experiment. Yeah, you can detect that. PCV की value ज़्यादा होगी तो? No. Any infection, any kind of infections you are suspecting, then in which layer after centrifugation you will be looking? Buffy coat. No role of PCV here. Okay, PCV means only relating to the RBCs, red blood cells, function of bone marrow, any kind of anything that is breaking or making RBCs, more or less quantitatively. Not qualitative. You can't see if the RBCs are sickle shape, if the RBCs are megaloblast, you can't see that. You only can see the volume of the RBC here. Okay. Now using this PCV, we can detect two important hematological indices. How many hematological indices we know? 3 or 4? 3 तो पता है. There are 4, including CI. That is CI मतलब there is an indicator ना, color indicator. देखो RBC indices में खोल के देखो. First one is MCV, second one is MCH, third one is MCHC, fourth is RDW, means red cell distribution width. ठीक है. और एक है CI. ओके, वो अभी छोड़ो उसको. So what is MCV? Mean corpuscular volume. What is MCHC? Do you know what it means? Basically what it means? इसका मतलब क्या है? Mean corpuscular volume. Already there was a class and I have taken that class only. Okay, let me revise it. Two hematological indices where you can use the value of PCV to detect the hematological indices. These two are MCV and MCHC. What is the formula of MCV? Kindly look into your books and say me. Tell to me. Hematocrit by RBC count. So what is the normal hematocrit? Suppose 45. What is the normal RBC count? Suppose 5 million. Then 45 by 5, 9 into 10 means 90. What is the average or average thing? What is the normal the span of MCV? Books में लिखा हुआ है देखो 78 to 94 or 96 and its unit will be someone it is written 94, someone 95, someone 96 but suppose we are simplifying it, we can say okay, take it 80 to 100. 80 से कम होगा तो कम है, 100 से ऊपर होगा तो ज़्यादा है. ठीक है. Simplifying it, accurate value is 78 to 96 or 95. Okay, so if we know the PCV value, we can use it here to calculate MCV. What is the formula of MCV? PCV by RBC count into 10. Okay, याद रहेगा सब. We can so suppose we are doing an experiment. What is the use of it? From PCV, we can say if he is having polycythemia, if he is having anemia, and using that Okay, if he's having anemia, very low amount of PCV, we can also think in that direction. He may be having some bone marrow disorders and all. Suppose now using that PCV value, we can also detect two RBC indices. One is MCV, one is MCHC. What is the formula of MCHC? Hemoglobin by PCV into 100. Suppose your hemoglobin is 15. PCV is 45. कितना आएगा? What is the normal range of MCHC? बुक्स में लिखा हुआ है, देखो एक बार. 32 to 38%, somewhere it's written 37%. इससे ज़्यादा नहीं हो सकता. क्यों नहीं हो सकता? वो भी थोड़ा सोच के बोलो. I think it's written in your books only. Why? MCHC value can't be more than 38%. Okay, so now we know the two RBC indices where you can apply the value of PCV. Okay, after getting the value of PCV, we can apply it to know two RBC indices. Applying that, the prerequisite is that you have to know the RBC count and hemoglobin. RBC count for what? MCV, hemoglobin for MCHC. Okay, now what is this MCV?
I said the average volume of RBC in a certain volume.
Yeah, you are right, quite right. Ruktim? क्या? Yes sir, क्या? Mean मतलब average, corpuscle मतलब RBCs and volume. Average volume of one RBC. Average volume of one RBC. Suppose I am always taking this as an example. Suppose this is a RBC, our red blood cell. Red blood cell is biconcave in shape. ठीक है, and it has central pillar. ठीक है, इसका जो वॉल्यूम होगा इसको क्या बोल देंगे? MCV, मीन कॉर्पस्कुलर वॉल्यूम. इसका वॉल्यूम क्या है? मीन कॉर्पस्कुलर वॉल्यूम. नाउ व्हाट इज MCH? Mean corpuscular hemoglobin. It is actually the weight of a hemoglobin present in a single RBC. Suppose these are hemoglobin. This is white, na? Suppose these are red. This is giving red pigments. The weight of this hemoglobin is MCH. So weight should always be in this gram, picogram. You are seeing in your book it's written picogram. Always the MCH would be in picogram and the volume would be in MCV, femtoliter. Okay, volume would be in femtoliter and this MCH would be in picogram. What is the normal this range of MCH? 27 to 32. So if this is the volume of an entire RBC, the weight of the hemoglobin present inside that RBC is MCH. Now suppose this hemoglobin is occupying 20% of the space of the entire RBC. This is, now this indices is MCHC. You will see in your that formula, MCHC is always written in percentage. So if in this this is the entire volume of the RBC, इसमें 20% is occupied by hemoglobin. That means the MCHC is 20%. If it is occupying 30%, okay, मतलब कितना वॉल्यूम ऑक्युपाई कर रहा है hemoglobin in an RBC cell. Simple. Okay. Now coming to the procedure of how to calculate PCV. So at first we need to draw blood. Which blood? Venous blood. Arterial blood is not required, it's quite cumbersome, and capillary blood is very small in amount. We need a large amount of blood for that. These are samples that will be taken and put it into that centrifuge machine in the Wintrobe tube. ठीक है? So how we calculate this PCV? कैसे कैलकुलेट करते हैं? फर्स्ट वी ड्रॉ ब्लड फ्रॉम द पेशेंट और सब्जेक्ट. ड्रॉ ब्लड, स्लो ड्रॉइंग ऑफ ब्लड फ्रॉम द वेनस ब्लड. ठीक है, देन वी नीड टू डू व्हाट? बाय यूजिंग पास्चुर पिपेट वी नीड टू प्लेस और पुट दैट सेम कंटेंट ऑफ दिस इज पास्चुर पिपेट. We need to draw after drawing of blood and using anticoagulants. We need to use anticoagulants. Why?
Already anticoagulant is there.
EDTA or double oxalate is already there. Why? For preventing of coagulation. अगर coagulation हो गया तो कुछ नहीं होगा, ठीक है, फिर serum और वो अलग हो जाएगा. What we need is first anticoagulant. Which anticoagulant? Double oxalate or EDTA. After mixing blood with anticoagulants, now we are going to take that sample by using a Pasteur pipette into a Wintrobe tube. This is a Wintrobe tube. What is the length of the Wintrobe tube? 11 centimeter. Of this 11 centimeter, 10 centimeter is graduated or calibrated. There is two calibrations you will see. I think it was in your exam also in spotter, in first day. You were in first day, no? हाँ, फर्स्ट डे स्पॉटर में भी था ये Wintrobe ट्यूब, ऊपर से नीचे एक, नीचे से ऊपर एक. सो जो ऊपर से नीचे तक है 0 to 10, that is for ESR. You are telling me about ESR. हाँ, ऊपर से नीचे जो है ना 1, 2, 3, 4, 5, that is for ESR. नीचे से ऊपर तक जो जाता है that is for PCV. So what is the function of Wintrobe tube now? To measure ESR and PCV. Okay. Now we will transfer the blood till which level? 10. Till the value of 10. See, 1, 2, 3, 4, 6, 7, 8, 9, 10. Till 10 we will put blood. But we will start putting blood from the bottom only, not from above. From the bottom, धीरे धीरे करके इसको ऊपर लेके आना है.
Suppose there is blood in this, so I will insert the tip of this pipette to the end and not release this. So blood is there. Now I gradually will release the bulb. Okay. So blood will be entering and it will gradually go up beyond 10. So then only when it went beyond, say up to this, then you gradually withdraw it. While withdrawing, the level will be coming down. Okay. Now it may come down to 0 or maybe less than 0 or it may be more than 0. Now you can again, if it is less than 0, again insert, just add, push little bit, then in that way you can adjust.
You can withdraw some blood if it's more.
Pressing it, making vacuum inside. So when I will be releasing, blood will come. Bottom. The tip of this at the bottom. Coming.
No air bubble should be present in between.
Since the tip is at the bottom, no air bubble will come. So I think this is enough. So if I release, again more blood will come, but I don't need any more. Now insert the tip at the bottom. Okay. Now you start releasing. Level is coming up.
It is done slowly.
Slowly, you have to do it very slowly. Yeah, it has reached to the tip now. Pull in the tube out. Transfer for better. I have taken excess now.
তোর ব্লাড ভালো তো? See? The value.
Next function, you will not be doing anything. Patient.
What? What is its name?
Pasture.
Pasteur pipette.
What you will be doing? First is
Louis Pasteur.
the tip at the bottom.
Pasteur pipette.
Don't release. You will be releasing it when it is inserted at the bottom. Okay. So then blood will gradually rise.
প্রেস কর নিয়ে যাবে তোরা একদম নিচে
Bottom, the bottom.
এটা স্যার ব্লাডটা মিক্স হয়ে যাবে না ওর ব্লাডের সাথে ওর ব্লাড
Anticoagulant.
আচ্ছা
Bottom এ গেছে?
একদম নিচে নিয়ে যা
এটাই
হ্যাঁ আস্তে আস্তে ছাড়
হ্যাঁ।
হোয়াট
Okay. This will do.
হয়ে যাবে
হ্যাঁ।
হোল্ড ইট এই এই আর ছাড়ছিস কেন আরে
এবার তো এয়ার ঢুকবে তো। হ্যাঁ। At the bottom, hold it
সেটা মোটটা কোথায়
slowly.
কভারিংটা
এটা তার
নিচে থেকে আস্তে উপরে ওঠা আস্তে এর উপরে ওঠা নিয়ে আয় আস্তে উপরের দিকে আয়
আস্তে।
ফিল করতে করতে উপরের দিকে আন
হ্যাঁ।
ভেরি গুড
You can bring the tip of the pipette gradually up, but
না টিপটা নিচে থাকবে কিন্তু
you will not
লেভেলের নিচে নিতে থাকবে টিপটা
So,
ঠিক আছে
there will
আস্তে
be
আস্তে উপরে
coming on entering then there.
এখানে যখন আসবে তখন আসতে পারবে
So that's
টিপটা
why I'm now advising.
টিপটা কিন্তু ব্লাড লেভেলের নিচে থাকবে হ্যাঁ ফিল কর কর
Then you
কর এই বার করছিস কেন
10 হয়ে গেল।
আর একটু উপরে না হ্যাঁ এবার এবার উপরে ওঠা ঠিক আছে
দেখ হয়েছে কিনা জিরো হয়েছে
ওকে
জিরো একটু বেশি আছে হয়নি হয়নি ওইটা ট্রান্সফার কর আগে হ্যাঁ এবার এক্সেসটা
দেখ তো ভিতরে কোথাও এয়ার বাবল আছে কিনা এটাতে এটাতে
পসিবলি নট
না না ঠিক আছে
এই প্রসিডিউর এইভাবে দেয়ার উইল নট বি এনি আবার
একটু কমাও বেশি না অল্প একটু কমালেই হবে হ্যাঁ হয়ে যাবে হয়ে যাবে দেখো দেখো উপরটা এয়ার বাবল দিয়ে দিলে ভিতরে টেক দিস পার্ট আউট তোর বাবল পার্টটাকে ওইখানে কেন দিলে এটা বার করটা হ্যাঁ হ্যাঁ
হ্যাঁ হ্যাঁ হ্যাঁ
আর একটু কমবে আর একটু কমবে দেখতো শিওর দেখো 0 থেকে উপর আছে না দেখতো দেখ হ্যাঁ আর একটু নে না এখান থেকে নে নে
বাট নরমালি
এবার দেখো
এখন জিরো
রাখো আবার
ডান ইউ টেক ইউর টিউব
এটা নে ফিল আপ কর যাও
give it to me